She was invisible. 8 years of saving lives, and not one doctor remembered her name. They called her the nurse like it was an insult. They laughed when she flagged infections. They rolled their eyes when she predicted complications that later killed patients. Dr. Victor Halden told her to her face, "You're just a nurse. Stay in your lane." Then the lights went out. Gunfire tore through the corridors. Armed men hunted a wounded federal witness inside the hospital walls, and the only person standing between those killers and their target was the nurse. Nobody thought mattered. The invisible woman they mocked was the only one trained to stop them. Before we go any further, if you're new here, hit that subscribe button right now and turn on notifications, because this channel is where the stories no one talks about finally get told. Drop a like if you're already hooked, and tell me in the comments, what city or country are you watching from? I want to see exactly how far this story travels. Now let's get into it. The thing about Silvercrest Military Medical Center was that it smelled like industrial cleaner and old coffee, not like the brochures suggested. The brochures showed gleaming hallways and staff with warm, camera-ready smiles. The reality was fluorescent lights that buzzed faintly on the 4th floor, a supply closet that never fully closed, and a nursing station that ran on caffeine and controlled chaos from 0600 to whenever the last chart got signed. Avery Nolan had worked here for 8 years. She knew which elevator stuck between 2 and 3, which vending machine gave you 2 bags of pretzels if you kicked the lower panel, and which attending physicians washed their hands before rounds versus after. She knew the hospital the way you only learn a place when nobody's watching you, because for 8 years, very few people had. She was 34, dark hair pulled back tight, hands that moved efficiently without wasted motion, a habit from somewhere she didn't talk about. She worked trauma and surgical recovery, which meant she saw soldiers at their worst. Broken bones and shattered joints, blast injuries and infections that bloomed fast if you weren't watching. She was always watching. That Tuesday started like most Tuesdays. She was on the floor by 5:55, 5 minutes before her official shift, because being early meant you caught the things the outgoing night nurse was too tired to notice. Bed 4 had a drainage tube that was sitting wrong, not catastrophically wrong, just slightly off, the kind of thing that becomes catastrophically wrong by noon if you ignore it. She adjusted it, charted the change, and moved on. By 07:30, the trauma bay had already taken 2 admissions, a staff sergeant from Fort Arden, who'd been in a vehicle rollover, and a specialist who'd come in through the night with a leg wound that had been improperly dressed at a forward clinic. Avery had flagged the specialist's wound to Dr. Marcus Lowe, the attending on rotation, because the tissue around the entry site had a discoloration she didn't like, a faint bruising pattern that spread in a way that suggested early necrotizing fasciitis rather than standard contusion. Lowe had glanced at it for approximately 4 seconds. "It's bruised, Nolan. That's what bruises look like." "The margin's irregular," she said, "and it's warm to the touch on the lateral edge, not the center. That's not typical for a contusion pattern." Lowe had already turned away. "Order a standard wound culture if it makes you feel better. Don't call me about it unless the culture comes back positive or his fever spikes above 103. She ordered the culture. She also quietly escalated the wound monitoring protocol in the chart and left a note for the evening shift with specific threshold criteria to watch for. 3 days later, when the culture came back confirming her suspicion and the specialist was rushed into emergency surgery to stop the infection's spread, Lowe received the credit for early identification. Avery received nothing, which was the usual arrangement. She had stopped being angry about it somewhere around year 4. Anger burned energy she needed for other things. The shift moved. She pushed a medication cart, reviewed post-op instructions with a corporal from the 10th Mountain Division, who kept trying to tell her he was fine to walk on a leg that had been surgically repaired 6 days ago, and spent 20 minutes on the phone with a pharmacist untangling a medication order that someone had entered incorrectly in the system. Standard Tuesday. She was at the nursing station, updating a chart, when she heard Dr. Victor Halden's voice before she saw him. Halden was chief of trauma surgery at Silvercrest. 51 years old, square-shouldered, with a manner that communicated at all times that the space around him was his space and everyone else was visiting. He was technically brilliant. Avery had watched him operate once through an observation window and recognized the economy of his movements, the precision, but his brilliance had curdled into certainty somewhere along the line, and certainty had curdled into contempt. He was walking the floor with 2 residents trailing him, talking loudly enough that the conversation carried past 3 closed curtains. "The issue with this floor," he was saying, "is that the support staff interprets observation as expertise. They see something often enough, and they start thinking they understand it." One of the residents, a young woman named Patel, glanced sideways toward the nursing station. She had the look of someone who knew what was coming and wasn't going to stop it. Halden stopped directly in front of Avery's station. He looked at the chart she was updating, then at her, with the particular kind of look that meant he was about to perform something. "Nolan," he said, "I heard you flagged Rodriguez in Bay 7 for potential compartment syndrome this morning. I documented swelling asymmetry in his lower left leg and noted that the firmness reading was higher than baseline. The documentation is in the chart." "I saw the documentation." He tilted his head slightly. "The diagnosis is post-surgical edema, which is what happens when we operate on a leg. What you described as firmness inconsistent with standard post-op presentation is a leg that had surgery on it recently." "I'm aware of what was done in surgery, Dr. Halden. The pressure differential between the operative and non-operative leg increased by 4 points between 600 and 830. That rate of change is within normal variation." He wasn't looking at her anymore. He was looking at the residents performing the lesson. "This is something you'll encounter, support staff who mistake pattern recognition for clinical judgment. The problem is that a nurse who's been here long enough has seen enough cases that they start constructing narratives. They see a detail and they build a story around it. But stories aren't diagnoses." Patel's eyes dropped to the floor. Avery kept her voice flat. "I'm not constructing a narrative. I'm documenting observable changes and their rate of progression. That's within the scope of nursing assessment." Halden smiled, which was worse than when he didn't. "Of course it is. Document what you like. That's what the chart is for." He picked up a different file from the station counter, leafed through it without apparent purpose, and set it back down. "Just a nurse who thinks she knows more than doctors," he said, more quietly, like he was sharing something private with the residents. "Every floor has one." He walked away. The residents followed. Patel looked back once, something complicated in her expression, and then she was gone too. Avery finished updating the chart for Rodriguez. She also requested a formal compartment pressure measurement be ordered by the on-call physician, citing the specific criteria from the hospital's protocol document, which meant it couldn't be quietly ignored. The on-call physician, Dr. Yates, ordered the measurement mostly to stop the request from sitting in his queue. The measurement came back elevated. Rodriguez was taken back into surgery 4 hours later to relieve the pressure before permanent nerve damage could set in. Halden was not in the building when the result came back. No one updated him that evening. No one called Avery to say she'd been right. She ate lunch in the break room alone, a sandwich from the cafeteria that was better than it looked, and read through a continuing education module on hemostatic agents that she'd been working through in pieces for 2 weeks. A tech named Darcy sat across from her for a while and talked about a show she was watching, and Avery listened and asked a few questions, because Darcy was 22 and genuinely funny, and the conversation was a reasonable thing to have during a lunch break. After Darcy left, Avery sat alone for a few minutes. The break room had a window that looked out over the parking structure. Gray sky. A hawk sitting on a light pole, not moving. She thought about Rodriguez's leg. She thought about the specialist from that morning. She thought, not for the first time, about how much of this job was fighting the same low-grade battle every day. Not against disease, which was straightforward, but against the infrastructure of dismissal that required her to justify every observation twice and still receive no acknowledgement when the observation proved correct. She finished her coffee and went back to work. The afternoon brought its own set of small crises. A patient in post-op pulled his IV line during a half-conscious moment of agitation, and there was blood on the sheets and a beeping monitor, and 30 seconds of organized chaos before it was sorted. A family in the waiting area needed translating. Their soldier spoke limited English, and the family spoke almost none. And Avery had enough Spanish to bridge the gap while the official interpreter was located. A discharge that should have happened at 1400 got held up because the transportation company sent the wrong vehicle, and someone had to make 4 phone calls to resolve it. By 1700, she was doing final checks on her patients before handoff. That was when the convoy arrived. She didn't see it directly at first. She heard it, the specific sound of multiple vehicles pulling into the emergency bay with more coordination than civilian ambulances, the low radio chatter, the different quality of boot steps on the floor below. She was on the 3rd floor, but the elevator shaft carried sound in this building, and she had learned long ago to pay attention to sounds that didn't fit the pattern. She went to the window at the end of the hall. 3 black SUVs and 2 army vehicles. Personnel moving with the clipped, deliberate purpose of people who were not there for routine medical care. 4 individuals who were clearly security, the way they positioned themselves, the angles they covered without thinking about it, and 2 who were clearly medical support. And in the middle of it, on a gurney being moved fast, a man. Avery watched the formation. Something about it was wrong. She couldn't have said immediately what exactly, the way you sometimes can't identify a wrong note, but you know the music has gone sideways. The formation was correct in its general shape, but the spacing on the left flank was wider than protocol called for. One of the security personnel glanced toward the parking structure twice in 30 seconds, which was a behavioral tell for someone expecting contact from an external position. The medical support had the patches of federal contractors, not military medics, which meant the decision to bring him here had been made quickly and the normal channels hadn't been used. She stood at the window for another 20 seconds, cataloging. Then she went back to her station and finished her handoff notes. The incoming nurse, Brendan, was a solid nurse and a talker. He talked while she briefed him, and she let him, because she needed him to actually process what she was telling him about Rodriguez and the specialist, and 2 other patients whose situations required attention. She gave him the relevant details in the order of importance, which she'd learned to do after years of handoffs where the critical information got lost in the middle. Rodriguez needs hourly checks on that pressure differential, she said. Not every 2 hours. Every hour. If it ticks up more than 2 points from where it is now, you call Yates directly, not the charge nurse first. Got it, Brendan said, writing. The specialist in 6 is still watching the wound. The culture report is in the chart. His fever has been stable at 99.8, but if it moves fast with this kind of infection. You know that. Yeah, I know. And the family in the waiting area for bed 9, they're still here. The daughter speaks some English. She's scared. It would take you 5 minutes to check in with her. Brendan looked up. You always do that. What? The family stuff. That's not in the handoff protocol. No, Avery said. It's not. She gathered her things and clocked out at 1742. She was in the locker room pulling on her jacket when she stopped. The patient they'd brought in, she'd been running the details through the back of her mind while doing handoff without fully acknowledging it. The chest wound was what they'd had him positioned for based on the gurney angle. The positioning of the security personnel, the spacing issue on the left flank, the repeated glancing toward the parking structure. The fact that the convoy vehicles had not left the bay, which she'd noticed in passing as she walked the hallway toward the locker room. They were still there. Federal contractors as medical support. She put her jacket on and stood for a moment. 8 years of being a nurse. Before that, a different kind of work in different kinds of places. A version of herself she'd put away carefully in a box and sealed with the understanding that it was finished. She had not unpacked that box. She had built a life that didn't require it. She went back to the floor. Brendan looked up from the station. Forget something? I'm going to stick around for a little while, she said. Check on Rodriguez. He shrugged. Suit yourself. He seems stable. She checked Rodriguez, who was stable. She also walked the floor in a slow arc that took her past the corridor where the secured room was. The hospital had 2 rooms that could be formally designated for high-security patients, with reinforced door frames and a sightline that was deliberately limited. And she counted the personnel she could see. 2 in the corridor, 1 at the nurse station down that wing, who was not a nurse from this hospital. 1 at the stairwell exit. Standard perimeter for a federal protective detail. Nothing that looked wrong on the surface, but the left flank spacing issue had bothered her at the window. A detail doesn't make a spacing error unless they're short a person, or they've had to adapt from their standard formation on short notice. Short notice meant something had changed from the original plan. Something had changed. She went back to the main station and pulled up the admission record that had been filed. Minimal information. The records for high-security patients were deliberately sparse until the security hold was lifted, but enough to show the admission time, the triage category, and the treating physician on record. Halden. Of course it was Halden. He was the chief of trauma surgery. She looked at the admission time. Then she looked at the current time. He should have been in with the patient for an initial assessment and preliminary treatment within 30 minutes of admission. The admission was 70 minutes ago. She had not seen Halden on the floor. She asked Brendan quietly, "Has Dr. Halden been through on the secured admission?" Brendan frowned. "I don't think so, but that's above my pay grade. The federal people handle their own coordination." "Right," Avery said. She found a chair near the nursing station where she could see the secured corridor and stayed there, reading the continuing education module on her phone. The hawk quality of it, waiting without telegraphing the wait, was something she'd had to learn once, in another context, and the skill hadn't gone anywhere. An hour passed. The floor went through its evening rhythms: dinner trays, medication rounds, a brief alarm from a patient in room 8 that resolved quickly. The personnel in the secured corridor changed once, smoothly, 2 of the 4 rotating out and 2 new ones rotating in. Professional. Well-coordinated. But still no Halden. At 1921, the hospital administrator, Martin Cross, walked down the secured corridor without a security escort. He was carrying a leather portfolio, and he walked with the specific purposefulness of a man who knew exactly where he was going. He knocked on the secured room door. One of the agents opened it. Cross went inside. Avery watched. A hospital administrator had no clinical reason to be in a secured patient room. None. Administrative matters relating to billing, legal documentation, or facility protocols were all handled externally from the care environment through designated channels with security coordination. Cross was inside for 9 minutes. When he came out, he wasn't carrying the leather portfolio anymore. He walked back down the corridor without making eye contact with anyone, took the elevator, and was gone. Avery looked at the clock. 19:30. She thought about the left flank spacing. She thought about Halden's absence. She thought about the federal contractors instead of military medics, and the convoy vehicles still parked in the bay, and now a hospital administrator leaving a secured room without the portfolio he'd brought in. She picked up her phone and did something she hadn't done in years. She sent a text to a number she'd never deleted, to a person who existed in the sealed box along with the rest of that previous life. The text was brief and used language that would mean nothing to anyone who hadn't worked in the same context. Silvercrest MMC, Red Haven. Secured federal admit, 1812 hours. Anomalies. Thought you should know. She sent it and put the phone in her pocket. At 1947, the lights went out. Not a flicker, not a partial outage. Complete loss of power, primary and what should have been the immediate emergency backup. A darkness that lasted approximately 4 seconds before the generator secondary kicked in and the floor flooded with the red-tinged emergency lighting. In those 4 seconds, she heard 3 things: the unsettled sound of patients reacting to sudden darkness, the sound of the stairwell door at the end of the secured corridor opening without the magnetic lock releasing it through proper channels, and faint but unmistakable through the heavy walls of the building, a sound she hadn't heard in years and still recognized without hesitation. A suppressed gunshot. She was already moving before the emergency lights came on. She moved low and fast along the wall, staying below the sight line of the secured corridor's single remaining camera, which was running on emergency power and covering a 40-degree field she'd mapped mentally during the hours she'd spent waiting. The red emergency lighting turned everything the color of old rust. Somewhere ahead, a patient was calling out, the voice high and confused, and she filed that sound away to address later because later had to exist first. The stairwell door at the end of the secured corridor was still open. That was wrong in 2 ways. The magnetic locks on that door required a keycard override to release, which meant someone with facility access had opened it from the stairwell side, and the door had a hydraulic closer that should have pulled it shut within 8 seconds. It had been open longer than that. Someone was holding it, or had wedged it, or the hydraulic mechanism had been disabled in advance. She stopped at the corner before the secured corridor and listened. 2 voices, low and clipped, in the area of the stairwell door. not the language she expected. She caught 3 words she recognized from a different time in her life: tactical terminology, directional, and understood enough to know they were coordinating positions, not panicking. These were not opportunists. These were trained personnel executing a plan. She looked back toward the nursing station. Brennan was behind the desk, phone in hand, trying to reach the security desk. His face had the particular expression of someone whose training was about to be tested in a way the training modules hadn't quite prepared for. The 2 other nurses on the floor had moved patients away from doorways. Good instinct, she noted. And one of them, a veteran nurse named Okafor, who'd been at Silvercrest longer than Avery, was moving with a steadiness that suggested she wasn't going to fall apart. Avery caught Okafor's eye across the red-lit corridor and made 3 gestures: down, quiet, stay. Okafor nodded once, immediate, no wasted expression, and passed it along the floor without speaking. Then Avery turned back to the secured corridor. The federal agents who'd been on perimeter were not visible. That was the part that required rapid reassessment. 4 personnel on perimeter when she'd last observed. 2 in the corridor, 1 at the nursing station down the wing, 1 at the stairwell. 1 suppressed shot. She had not heard a second shot, which meant either the first had been sufficient for whatever its target was, or the attackers were now operating with blades or manual methods to stay quiet, both of which indicated a level of discipline that compressed her available time significantly. She needed something. The crash cart at the end of the corridor had a locked compartment at the bottom that held the defibrillator paddles and related equipment, but the frame of the cart was aluminum and tubular. She'd grabbed the cart handle to move it twice in the past month. She knew its weight. She moved to it in 12 steps, staying against the wall, and pulled the lower tray free. A solid flat piece of steel used for medication staging during resuscitation, approximately 40 centimeters long, with enough heft to matter. It wasn't much. She didn't need much yet. She went into the secured corridor. The first thing she saw was one of the federal agents on the floor near the room door. He was alive. She could see the rise of his chest in the red light, but unconscious, and the blood on his temple had come from a hard impact rather than a gunshot, which meant they'd taken him down quietly first. His sidearm was still in the holster. They hadn't taken the weapon, which was either careless or meant they had enough of their own that they hadn't wanted to pause. She took the weapon, checked the chamber in the dark by feel, and moved it to her left hand because her left hand was going to be the support hand if she needed to use it, and she needed the steel tray in her right for what she was hearing. Movement in the supply alcove to her left. Not loud movement, careful movement, the kind you make when you're trying not to be heard, which paradoxically is louder than normal movement to anyone trained to listen for the difference. She flattened against the wall beside the alcove opening and waited. He came out at normal walking pace, which was the smart approach in a building where running created noise and drew attention. He was wearing scrubs, real scrubs, not a costume, which meant someone had sourced actual Silvercrest scrubs in advance, and he had a suppressed weapon at his side rather than raised, because a raised weapon in a corridor is more conspicuous than a lowered one. He turned left out of the alcove, away from her, and had taken 2 steps when she moved. She hit him low and from behind, not with the tray but with her elbow to the back of his knee, which dropped him. The tray came down on the back of his skull before he could register what was happening, not hard enough to kill but hard enough to end the problem, and he went down without a sound beyond the muffled impact of a body losing coordination. She was on him in the same motion, checking for secondary weapons. There was a blade in an ankle holster, and zip-tying his wrists with the restraint kit from her scrub pocket, which she carried because patient restraint was occasionally necessary, and the official kit was across the floor. She had been a nurse for 8 years. She had done the work of a nurse, genuinely, completely, with the full weight of her attention and her care. But the other thing, the thing she had sealed away, had been her first language. And your first language doesn't leave you. It goes quiet. It waits. She was already breathing differently. Not faster, slower, deeper. The part of her brain that managed clinical emergencies had handed authority to a different part, one that ran cooler and thought in angles and distances rather than symptoms and dosages. She moved to the secured room door. It was closed but not locked. The magnetic lock had released when the primary power went down, which was by design to allow patient evacuation, but it meant the room was not secure. She opened it with her back to the wall, the way you open a door when you don't know what's on the other side of it, and led with her eyes rather than her body. The patient was on the bed. He was alive. She could see the monitoring equipment on battery backup reading his vitals, which were not good. The chest wound the gurney angle had suggested was real, and it had been partially treated but not fully stabilized, the surgical dressing on his left thoracic region showing a seep pattern that meant the underlying repair was incomplete or had been disrupted. The second federal agent in the room was not on the floor. He was standing at the window on the far wall, and he had his weapon raised and pointed at the door before she'd finished opening it. "Don't," she said quietly. He didn't fire. Professional training. You don't fire at a shape in a doorway when you haven't confirmed the target. "Nurse Nolan," she said, "third floor staff. I took down one of theirs in the corridor. There's at least one more in the stairwell. Your man outside the door is unconscious but breathing." A pause. "Step into the room." She stepped in. He looked at the weapon in her left hand. She'd kept it low, non-threatening, and at her scrubs and at the steel tray, and made a rapid calculation. "Where's Martinez?" "If Martinez is the one in the corridor, he's down, not dead. They hit him from behind." "How many?" "I've confirmed 2. Based on formation when they arrived, the original security detail was 4 agents. I took down one hostile in the alcove. I heard at least 2 voices at the stairwell entry point before I moved." She crossed the room to the patient and looked at the dressing without touching it. "He needs the rest of this wound stabilized. What was done before the power went out?" The agent, his name tag read Solis, stared at her. "You're a nurse?" "Yes, and your witness is going to go into hemothorax in the next 20 to 40 minutes if the intercostal damage isn't addressed, which means whatever he knows needs to be either extracted now or he needs to be in a surgical suite in the next 20 minutes. She met Solis's eyes. "Pick one." Solis lowered his weapon slightly. "Not all the way." "Smart." "The surgical suite is 3 floors down." "I know where the surgical suite is." She was already looking at the room's supply setup, cataloging what was available. "Do you have comms to the exterior?" "Radio's been jammed since the power drop." "Your vehicles are still in the bay. If they jammed internal comms, they're working from a device inside the building. Take out the device or take out the people running it. The jam breaks." She found what she needed in the supply cabinet, a thoracic drainage kit, backup battery on the suction unit, and began setting up. "I need you to hold the door." "I'm not leaving you alone in here." "Then I need you to hold the door while staying in here, which means covering the entry and not getting in my way." She looked at him once more. "I've done this before. Not in a hospital." He moved to the door without asking what that meant. She worked. The patient, she still didn't know his name, the admission record had been sparse, was semi-conscious, aware enough to feel what she was doing, but not aware enough to be rational about it. He grabbed her wrist when she began preparing the drainage site, and she let him hold it for a moment, which was not protocol, but was the human thing to do. Because a man who was afraid and in pain and alone in a dark room with strangers needed 1 second of contact before the pain got worse. "I need you to breathe out when I tell you," she said. "Slow. All the way out. Can you do that?" His eyes found her face in the red light. He didn't speak, but he nodded. "Okay," she said. "We're going to fix this." She was halfway through the procedure, the drain seated, the suction unit pulling correctly, his breathing already easing as the pressure differential corrected, when the shooting started in the corridor. Not suppressed this time. Open fire, close range, the sound of it shockingly loud inside the concrete and steel of the building. 2 shots, then a third, then a pause that was worse than the shots, because a pause meant someone was assessing rather than responding, which meant someone was winning. Solis had his weapon up at the door. "That's coming from the main corridor." "Brendan," Avery said. She finished the drain. "You don't stop in the middle of a procedure. You don't, not even now." Secured the tubing, checked the seal, and was on her feet in the same motion. "There are patients out there." "You cannot go into an active—" "There are patients out there," she said again, and the way she said it stopped him from finishing the sentence. She went out the door low and fast. The main corridor had changed. The red emergency lighting had been partially blocked. Someone had taken down the light panel at the far end, possibly deliberately. and the visual field was cut in half. She could make out shapes, a figure down near the elevator, not moving. A second figure pressed against the wall near room 8's doorway, armed, oriented away from her toward the nursing station. Brendan was behind the nursing station desk, which was cover but not good cover, and he was on the floor with his arms over his head, which was the right thing to do and also meant he wasn't going anywhere. Okafor was not visible, which Avery processed as a good sign. If Okafor was not visible, she'd followed the instruction to get down and stay quiet, and she was smart enough to do that correctly. The armed figure at room 8's doorway was exposed on his left side. He was watching the nursing station, anticipating movement from that direction, and hadn't processed yet that there was a door behind him. Avery didn't have a clear angle for the weapon. The corridor geometry was wrong for a shot that she could guarantee, and a shot she couldn't guarantee in a hallway with patients in rooms on both sides was not a shot she was going to take. She had the tray in her right hand and 4 meters of corridor. She moved. He heard her at 2 meters, started to turn, and was already too late for the turn to matter. She hit him with the tray on the leading arm to break his weapon grip and followed it with her elbow to his sternum, which dropped his diaphragm and took the fight out of him faster than a strike to the face would have. He went down. She was on his weapon before he could recover, kicked it across the floor toward the nursing station, and had her knee in his back and his wrist torqued behind him in the position that made attempting to rise genuinely unpleasant. "Brendan," she said. Not loudly. "Get that weapon and get back behind the desk." A scrambling sound, a pause. "I've got it. Is it clear down the east corridor from where you are?" I think so. I can't see." "Look, Brendan." Another pause. "Clear. I think clear." She secured the man on the floor with the second restraint kit she kept in her left pocket. She had been carrying 2 since year 3, after an incident with a combative patient, and stood up. Her hands were shaking slightly. Not from fear. The fear was there. She wasn't going to pretend otherwise, a low hum of it behind everything she was doing, but from adrenaline working through a system that was running very hot. She pressed them flat against her thighs for 2 seconds until the shaking stopped, which was a trick she'd learned a long time ago and which still worked. She moved to the east corridor. It was clear. Okafor had gotten 3 ambulatory patients into room 11 and closed the door, a decision that was tactically sound in a way that suggested Okafor had been in difficult situations before, which Avery filed away to ask about later. 2 other nurses were in the med room with the door locked, which was less ideal but understandable. "Okafor?" she said at the door of room 11. The door opened immediately. Okafor's face in the emergency lighting was calm in the way of someone who is frightened and managing it. "You're still here," Okafor said. "I'm still here. You did right. Keep them in here." Avery counted quickly. "Rodriguez needs to stay flat. Don't let him move regardless of what he hears. He's been asking what's happening. Tell him it's a drill gone wrong. He'll know it isn't, but it gives him something to hold on to." She went back to the main corridor. The figure near the elevator who'd been down was gone. That was new and bad. She'd registered him as neutralized, down, not moving. But she hadn't confirmed it, and in the time she'd spent with Okafor, whoever it was had either recovered or been moved. Either option was a problem. She was standing in the corridor working the geometry. 3 confirmed hostiles, 2 taken down, 1 unaccounted for, plus the stairwell position which she still hadn't cleared, when the elevator opened. Not the figure from the corridor, someone new. He was bigger than the others, dressed the same way in scrubs. And he came out of the elevator already moving with his weapon up. And for the half second before he located her, she had a choice between the weapon in her left hand and the distance she could close before he adjusted his aim. She threw the steel tray. It was not a graceful or cinematic thing. It was a flat piece of metal spinning end over end across 12 feet of corridor and hitting him across the forearms as he adjusted his aim, which disrupted his shot and bought her the half second she needed to close the distance. She hit him low, driving with her legs the way you have to when you're significantly outweighed, and they went into the wall together hard enough that the impact rattled the light fixture above them. He was strong, stronger than the others. He got a hand around her left forearm, the one with the weapon, and the grip was the kind that compressed bone, and she made a sound she hadn't planned to make and lost the weapon. It clattered across the floor. She headbutted him. It was ugly, and it hurt her as much as it hurt him, which was the part nobody mentioned about that particular technique, but it rocked him enough to break the grip, and she got her feet under her and put 2 strikes into his solar plexus with everything she had. He went to one knee. She drove his head down to meet her rising knee, and he went to the floor and stayed there. She stood over him in the red light, breathing hard. Her left arm was going to bruise badly. She could already feel it, a deep, aching pressure that would be spectacular by morning. She retrieved the weapon from the floor, checked it again by feel, and stood for a moment in the corridor, 4 down. The stairwell position uncleared. The witness stable for now, but requiring surgery she couldn't provide in this room. Solis was back there with a weapon and unclear comms. Brennan was behind the desk with a weapon he'd probably never fired outside of a range. Okafor had 3 patients in a locked room. And somewhere in this building were the people who'd helped plan this. The people who'd provided the access, the scrubs, the facility layout, the timing. She thought about Martin Cross leaving the secured room without his portfolio. She thought about Halden not appearing for an admission he was the physician of record on. She pulled out her phone. The text she'd sent to the number in the sealed box had no reply yet. She wasn't surprised. That number was a dormant contact, not a monitored line, and she hadn't used it in 4 years. She didn't know if it still worked. She'd sent the message on instinct, and instinct was not always reliable. She sent a second message, more specific this time. Location, floor plan, hostile count, witness status, and 4 words at the end, asset at risk, confirmed. Then she put the phone away and moved toward the stairwell. The door was still propped. She approached it from the hinge side, which was the correct side, and listened at the gap for 15 seconds before she moved. The stairwell was dark. No emergency lighting on this bank, which meant that light panel had also been taken out in advance. She could hear breathing below her, 2 levels down, and the faint squawk of a radio attempting to break through jamming and failing. She started down. The 3rd step was where she nearly died. He was above her, not below, pressed into the angle of the landing where the stairwell turned, and he'd waited with the patience of someone who was very good at this. She felt the air displacement before she heard him move, and she dropped, not away but toward him, which was the counterintuitive choice that saved her because he'd been braced for her to go away from the threat. His arm came down on empty air, and she grabbed it going past him and used his momentum and hers together to put him into the railing. The railing held. He didn't. He went over it with a sound she wasn't going to think about right now, dropping 8 feet to the landing below, and she heard him hit and heard the way the hitting sounded when something had broken, and she kept moving because stopping was not an option. Below her, the radio squawked again, more clearly, and this time someone answered it, not in the language of the others, in English. "Cross," the voice said. "What's your status? We need the package moved in the next 10 minutes or the window closes." A pause. Static. "Cross." "Answer." Avery froze on the stairs. "Cross." Martin Cross. The hospital administrator who had walked into a secured patient room and come out without his portfolio. He was not a peripheral player. He was running communications. She pressed herself against the stairwell wall, her heart doing something irregular that she acknowledged and set aside, and listened as the voice on the radio repeated the call and got no answer, and finally said with controlled frustration, "Abort secondary, hold position, we're going to another route." Another route. She had to get back to the witness, right now. She turned on the stairs and went back up at speed. Not quiet anymore because quiet had a different cost-benefit calculation now, and she came out of the stairwell into the secured corridor and saw, from 30 feet away, that the door to the secured room was open. Solis was visible in the doorway. He was on his feet, which was good. He was facing inward, which was bad, because it meant something inside the room had his attention. She covered the 30 feet. Inside the room, standing at the far side of the bed with a syringe in his hand and the particular expression of someone who had made a decision and was not going to unmake it, was Dr. Victor Halden. Part 3. Halden didn't look at her when she came through the door. He was looking at the patient, the syringe held at the level of the IV port, and his expression was the one she recognized from rounds. That sealed-off certainty, the face of a man who had decided he was the most qualified person in any room he entered and had stopped questioning it so long ago that the habit had calcified into something else entirely. "Step away from the line," Avery said. He looked up then. Whatever he'd expected when he heard movement at the door, it wasn't her. She watched his face move through surprise and land, predictably, on contempt. Old habit. Nolan. He said her name the way you'd identify a piece of furniture that had ended up in the wrong room. You need to leave. Step away from the IV line, Dr. Halden. Solis had his weapon on Halden but hadn't fired, which was the right call. A federal agent shooting the chief of trauma surgery in a military hospital required a level of certainty about intent that a syringe at an IV port didn't quite satisfy, legally, yet. Avery understood the hesitation, and she also understood they had about 12 seconds before it stopped mattering. This patient is in my care, Halden said. Whatever you think, your butts, put the syringe down. I'm correcting a medication error. The previous dosage. There was no previous dosage. He came in 2 hours ago and the medication record is empty because nobody did a full admission workup. She crossed the room. Not fast. Fast would make him reactive, but steady and direct, the way you approach an animal that hasn't decided yet whether to run or bite. The syringe. Down. He pulled it back slightly, away from the port, which was not the same as putting it down, but it was movement in the right direction and it told her he wasn't fully committed yet. There was still a version of Victor Halden that wanted to believe he could talk his way through this, that the 30 years of authority attached to his name would do what it had always done and reorganize the room around him. You have no idea what's at stake, he said. I know exactly what's at stake. She stopped 2 feet from him. Hand me the syringe. Something moved in his face. Not guilt. She didn't think it was guilt. More like the particular vertigo of a man who has just understood that the thing he thought would work is not going to work. He looked at the syringe. He looked at her. He set it on the bedside tray. Solis crossed the room in 3 steps and had Halden's wrists behind his back before the syringe finished settling, and Halden made a sound of genuine surprise, like he'd expected the gesture to end the situation rather than accelerate it. You can't. I'm the chief of surgery at this, sir, Solis said, with the flat patience of someone who had restrained significantly more dangerous people than this. Please stop talking. Avery picked up the syringe without touching the plunger and set it on the far side of the tray, out of reach. Then she looked at what was in it. The fluid was clear, which eliminated a few possibilities and narrowed it significantly. The viscosity looked consistent with potassium chloride at a concentration that would stop a heart in under 3 minutes and present, without a specific talk screen, as cardiac event. Fast, clean, deniable in a patient who already had a serious chest wound and compromised vitals. She looked at Halden. He wasn't looking at her. He was looking at the wall with the expression of a man revising something internally. How long? She asked. He didn't answer. How long have you been running records interference for them? Was Rodriguez part of it? Was the specialist? She heard her own voice and noted that it was level, which surprised her slightly because what she was feeling was not level. How many patients? That's not your concern. It absolutely is my concern. She stepped closer. Because I flagged both of those men and you overrode my assessments, and now I'm wondering if that was arrogance or if it was deliberate, and those are very different things, Dr. Halden. He looked at her then, and what she saw in his face, the thing she hadn't expected, was not defiance. It was exhaustion. The deep, specific exhaustion of a person who has been carrying something heavy for longer than they should have and is, on some level, relieved to put it down, even this way. You don't know what they offered, he said. I don't need to. She turned away from him because there was nothing useful left to extract, and the patient's monitor was showing a rhythm she wanted to look at more carefully. The drain was still functioning, the suction reading correct, but his blood pressure had dropped 4 points since she'd last checked, and his respiratory rate was climbing, which suggested the intercostal repair was holding, but the underlying lung tissue was still compromised. He needs surgery, she said to Solis. Real surgery, not what I can do in here. Building's not clear. How many are left? Unknown. We had 6 on the perimeter team. I've got 2 confirmed down from my side. You've accounted for... He paused. How many did you account for? 4. 1 in the alcove, 1 in the main corridor, 1 at the elevator, 1 in the stairwell. She didn't elaborate on the stairwell. Plus Halden, who was the inside access point. Solis looked at her for a moment with an expression she recognized as recalibration, the look of someone updating a model they'd been running on insufficient data. He was good at not showing much, but that look got through. You cleared 4 hostiles. The one in the stairwell may still be a problem. He went over the railing to the landing below. I don't know what condition he's in. You went into the stairwell alone. There wasn't anyone else available. He was quiet for a second. Who are you? A nurse, she said. Can you get to your vehicles? The east exit is closer to the bay. If the stairwell below the 3rd floor is compromised, the east stairwell is a separate bank. I haven't been in that one. She was already thinking through the route. If Cross is running comms from inside the building, he's on a lower floor. The jamming device has to be close to the primary comms infrastructure, which means basement or 1st floor. He'll have at least one person with him. Cross, Solis repeated. Martin Cross, hospital administrator. He was in this room earlier tonight. He left without the portfolio he brought in. She looked at Solis directly. Whatever was in that portfolio is in this room somewhere. They both looked at the room. Holden made a small sound from the corner where Solis had restrained him to the chair rail using his own belt, which was inelegant but functional. Avery checked under the bed first because it was the obvious place, and people defaulted to obvious when they were operating on a plan someone else had written. Nothing. She checked behind the monitoring equipment, behind the privacy curtain stack, inside the sharps container. Not inside, but the edge of the container was magnetic, and something had been attached to it. A flat drive. Matte black, the size of a thumb, adhered to the exterior of the sharps container with the particular low-profile tape used for equipment mounting. She peeled it free carefully and held it up. Solis crossed the room in 2 steps and took it from her with the care of someone handling something that had just changed the shape of the evening. That's what they came for, Avery said. They came for the witness. They came for that. She looked at the patient. He was the delivery mechanism. He carried it in, probably without knowing it, or he knew and the chest wound was his answer to their retrieval plan. Either way, the drive is the primary target and the witness is the secondary. She turned it over in her mind, which means if we can get him out and get comms back up, the drive reaches whoever he was bringing it to and the operation is over. Solis was already looking at the door. East stairwell. I'll take the lead. Nolan, I know the building, and you need to carry him, she said, and the simplicity of the logistics argument ended the discussion. She went out first. The main corridor was quiet in a way that felt provisional, the quiet of a situation that was paused rather than finished. Brendan was still behind the nursing station desk, and when Avery moved past, he looked up with the expression of a man who had been sitting in fear for an indeterminate amount of time and was genuinely unsure whether rescue had arrived or the situation had gotten worse. Brendan, east stairwell. I need you to check it from the nursing station side. Just open the door and listen. Don't go in. He stood up. He was shaking visibly, but he moved, which was what counted. He went to the stairwell door and opened it, and listened, and called back. Clear. I don't hear anything. Stay on this floor, don't open any exterior doors, and don't answer any calls from administration until you hear from me. What? Okay. Okay. She went back to the room. Solis had the patient on the gurney, which was not ideal for a chest drain patient, but was better than a fireman carry over a stairwell, and Holden was still restrained to the chair rail and had the grace to not say anything as they moved. The east stairwell went quickly. Avery went first, cleared each landing, came back, waved them forward. The patient stayed unconscious, which was both good, he wasn't agitated, and concerning. His pressure was continuing to drift. 2 floors, 1 floor, ground level. The door to the east exit corridor was 30 feet from the emergency bay entrance. And it was blocked, not blocked by a person, blocked by a crash cart that had been positioned across the corridor with a kind of deliberateness that didn't suggest accident. 2 chairs pulled from the waiting area were jammed under the wheels. Someone had taken the time to do this carefully, which meant they'd anticipated this exit. Other route, Solis said. There's 1 more ground-level exit on the west side. It comes out near the ambulance staging area. That adds 5 minutes. I know. The patient's monitor, Solis had the portable unit clipped to the gurney, alarmed softly. Avery looked at the reading. His oxygen saturation had dropped to 89, which was the number that meant the situation had just compressed its own timeline. "We can't take 5 minutes," she said. "I need to move the cart." She went to the crash cart and pulled the chairs free and shoved it aside, which required more force than it should have because whoever had positioned it had locked the wheels. She unlocked them by feel, in the dark, her bruised left arm sending a steady complaint that she noted and ignored, and got the cart clear in 90 seconds. The exit door opened onto the bay. Cold Colorado night, sharp and immediate after the recycled air of the building. The convoy vehicles were still there. She'd been right about that. And the Army vehicles had their engines running, which meant the drivers had stayed with them. 2 figures came off the vehicles fast when the door opened, weapons up, and she put her hands out and said, loudly and clearly, "Nurse Nolan, 3rd floor staff. I have Agent Solis and the witness. He's critical. I need a surgeon." A pause. Then, "Solis?" "Confirm." Solis came through the door behind her. "Confirmed. Stand down." The weapons came down. The next 30 seconds were organized chaos. Personnel moving the patient from the hospital gurney to a vehicle stretcher, a medic appearing from somewhere with equipment, radio calls going out that she could hear were getting through, which meant they were outside the jamming radius. She stood in the cold bay and watched and let her hand shake for a moment because there was nobody immediately in front of her who needed her to stop them. One of the Army drivers, a young corporal who looked about 22 and was doing his best to appear calm, handed her a thermal blanket without being asked. She hadn't noticed she was cold until that moment. She took it. "You come out of the building?" he asked. "Yes." "You okay?" She thought about it honestly for a second. Her left arm was deeply bruised and possibly had a small fracture in the radius. She'd assess later. She had a cut on her right palm she didn't remember getting. Her hands had stopped shaking, but she was aware of a low tremor in her legs that was adrenaline working through muscle that had been operating at capacity. She was going to need to eat something in the next hour, or she was going to crash hard. "I'm functional," she said, which was the true answer. The corporal nodded like that made complete sense. Solis appeared beside her. He had his radio in hand and was mid-call, and he held up one finger. "Wait," and finished the call and lowered it. "Response team is 4 minutes out. Building will be secured." He looked at her. "Cross is still inside." "I know." "The team will find him. He has at least one person with him, and he knows this building well enough to have pre-positioned a blocking card on the East Corridor exit. He's not hiding. He's managing." She looked at the building. "He's going to try to move." "The response team, 4 minutes." She turned to look at him. Cross has been planning this for however long he's been working with these people. He will have an exit that doesn't involve the main entrances. Service tunnel, utility access, parking structure connection. This building has 3 sub-level connections to adjacent structures. Solis looked at her. The recalibration expression again, more pronounced this time. "You know the sub-level layout. I've worked here for 8 years. I've had patients transported through every level of this building." She handed the thermal blanket back to the corporal, which was a decision her body disagreed with. "The utility access point is in the basement north side. It connects to the parking structure service corridor. If he reaches the structure, he reaches a vehicle and he's gone before the response team seals the perimeter." "Nolan, you've done enough." "Has he?" Solis didn't answer that. She went back inside. The basement was a different texture of dark than the floors above. No emergency lighting on this level, which meant it had been disabled specifically, because the generator backup was supposed to cover the entire building, and this was a deliberate exclusion. She moved by memory, and the faint glow of her phone screen held low, navigating the corridors she'd walked dozens of times, pushing equipment carts and accompanying patient transports. She heard Cross before she saw him. He was not moving quietly because he was moving fast, and fast in a basement corridor with equipment lining both walls created a constant low background of incidental contact, a shoulder against a cabinet, a foot catching a cable conduit, the kind of noise that precise movement couldn't eliminate at speed. She killed her phone screen and stopped moving. He was ahead of her, 40 feet, maybe 50, moving away from her toward the north end. The person with him, she could now hear 2 sets of footsteps, was slightly ahead, which meant Cross was being escorted rather than leading, which meant the other person was the tactical decision-maker and Cross was the navigation resource. She had the weapon from the corridor in her waistband. One tactical decision-maker in the dark at 40 feet with a handgun she hadn't zeroed, and a left arm that was going to affect her grip was not a calculation she liked. She needed to close the distance before they reached the utility door. She moved. The basement corridor had a specific property she'd used before during equipment transport. The floor was polished concrete with a slight crown in the center, smooth enough that a careful person moving without lifting their feet made almost no sound. She'd learned this accidentally, pushing a heavy equipment cart at 0300, noticing that her footsteps had disappeared. She used it now, staying on the crown, moving with the shuffle step that was slower than a walk but nearly silent. 30 feet, 25. She could see them now as shapes in the dark. The escort was broad-shouldered, moving with the compressed readiness of someone expecting contact. Cross behind him, the shape of the portfolio visible again, tucked under his arm. He'd retrieved the portfolio from somewhere, not the same one. The drive was with Solis, but another one. A backup or a second package. She was 20 feet out when the escort stopped. She stopped with him. The fraction of a second between his pause and hers was the thing that mattered, and she'd matched his pause closely enough that the sound differential was within the range of ordinary ambient noise. He listened. She breathed very slowly through her open mouth, which reduced the sound of respiration to nearly nothing, a technique she'd learned in conditions she was not going to think about right now. 10 seconds. 15. He started moving again. She followed. The utility door was a heavy steel door with a push bar, and the push bar was going to make noise when it opened regardless of how carefully they handled it. She had to close to contact range before that door opened, because the moment it did, the sound would cover movement, and the opening would give them light from the structure beyond, and she'd lose her equalization advantage. 12 feet. 8. The escort reached for the push bar. She moved. She went for the escort first because he was the threat, and she went for the arm with the weapon because that was always the arm to address, and she got her right hand around his wrist and drove his weapon hand into the doorframe before he'd completed the turn. The gun discharged. The sound in the enclosed basement was extraordinary, an impact of sound that she felt in her sternum. And the round went into the doorframe, and the recoil completed the disarmament because his hand spasmed open on impact, cross-bolted, not toward the utility door, away from it, back the way they'd come, which was instinct over planning because planning would have told him the utility door was the only viable exit. He ran, and she let him run because the escort was still a problem, and a running man in a dark basement makes a predictable amount of noise. The escort was bigger than her and had recovered faster than the others. He got his hand around her right wrist and he used his size the way trained people do, turning her leverage against her, and for 3 seconds she was losing. Her back hit the wall and the impact drove the breath out of her, and she had about half a second before the positional disadvantage became unrecoverable. She stomped on his instep with her full weight on the heel, which is not a dramatic technique but which caused enough involuntary pain response to break his grip, and she got her left arm up and into his throat, not a strike, a bar, and walked forward into him until the back of his head met the wall behind him. He went down and didn't come back up, and her left arm informed her loudly that that had been a poor choice of limb for that application. She left him and went after Cross. He'd made it to the far end of the corridor and turned toward the service elevator, which didn't run on emergency power and was therefore a dead end, and he was standing in front of it when she caught up. He had the portfolio pressed against his chest like a shield, which was either instinct or a gesture of futile protection. She stopped 10 feet from him. In the dark, she couldn't fully read his expression. She could hear his breathing, ragged, a man who did not run often. She could see the white collar of his shirt. "It's over," she said. "You don't—" He stopped, started again. "The people I work with are not people who leave things unfinished. The drive is with the federal response team that's currently securing the building." She kept her voice even. "Whatever's in that portfolio is the only card you have left, and you're in a basement with no exits." He was quiet for a moment. "I was going to retire in 2 years," he said, and it came out strange. Not an explanation, not a justification, more like a fact he was confused by, as if the plan had existed so concretely in his mind that its dissolution was genuinely disorienting. "Where's the jamming device?" He didn't answer. "Cross, The federal response team is in the building right now. Where's the device? Electrical room, he said after a pause. Sublevel junction box. North wall. She pulled out her phone and sent the location to Solis in 3 words. The text showed as delivered, which meant comms were already partially restored. She stood in the dark basement with Martin Cross and listened to the sounds of the building being reclaimed above her. Boots on stairs, shouted identifications, the specific vocabulary of a building being methodically cleared. Cross sat down on the floor against the wall, and she stood and watched him, and neither of them said anything else. Her left arm hurt badly. Her right palm was bleeding again where the cut had reopened during the corridor work. She was very cold and very tired, and the adrenaline that had been running her for the past 90 minutes was beginning to withdraw, leaving behind the specific empty feeling of a system that had been running at maximum and was now being asked to wind down. She thought about Rodriguez on the 3rd floor, about the specialist, about Brendan behind the nursing station desk, about Okafor with 3 patients in room 11, holding them steady in the dark. Boots on the stairs. A light beam swept down the corridor, a tactical light, white and sharp, and she put her hands out and identified herself, and the light swung toward her and past her and landed on Cross on the floor. The response team moved past her efficiently. 2 of them stayed with Cross. A 3rd stopped in front of her. Nurse Nolan? He was holding a tablet with a photograph on it, and he looked at the photograph and at her face in the same motion. We got a text message from this number with location data. That was me. He looked at her, at the scrubs, at her arm, at the blood on her palm, at the general condition of a person who had been in a building for 90 minutes of what the building had just been through. Are you injured? Probably a radius fracture in the left arm. It can wait. She looked past him toward the stairs. The witness is in the emergency bay. He was stable when I left him, but his SATs were dropping. Solis has the drive. We know. Solis briefed us. The agent, she could see now his jacket said Federal Task Force, looked at her with an expression she recognized as the same recalibration she'd seen on Solis's face, that updating the model look. He said you cleared 4 hostiles alone. 5, she said. There's 1 in the east stairwell on the 2nd landing and 1 in the basement corridor about 60 feet north. Neither of them are going anywhere. The agent was quiet for a moment. Ma'am, who are you? She looked at him. 8 years of this building in her bones. 8 years of fighting the low-grade battle of being invisible, of having her assessments dismissed and her observations attributed to narratives she was supposedly constructing rather than realities she was observing. 8 years of Rodriguez's legs and infected wounds and families in waiting rooms and handoff notes that nobody read. She was a nurse. That was the true answer and the complete answer. But the other part of her, the part she'd sealed away, was standing in a Federal Task Force agent's flashlight beam in a basement corridor, breathing steadily after what she'd just moved through, and it was not sealed away anymore. Avery Nolan, she said, 3rd floor nursing staff. The agent looked like he wanted to ask a follow-up question, and she looked like she was finished answering them. He nodded. We'll need a full debrief. I know. She started toward the stairs. After I check on my patients. She was halfway up the 1st flight when her phone buzzed. She looked at it. A reply to the message she'd sent hours ago to the number in the sealed box. 4 words, no punctuation, no identification. We're already here. Look up. She stopped on the stairs. She looked up. At the top of the stairwell, backlit by the restored emergency lighting that was now running correctly, was a figure she hadn't seen in 4 years. A woman she recognized by posture before she recognized her face. The particular stillness of someone who'd spent a long time learning how to take up exactly as much space as was necessary and not 1 inch more. Avery's hand tightened on the railing. The woman looked down at her and said calmly, as if they'd last seen each other last Thursday, "We need to talk about what you found in that room." The woman's name was Dara Voss, and the last time Avery had seen her, they'd been in a forward operating position in a country whose name neither of them said out loud in casual conversation, and Voss had been the one who'd made the call that ended the operation and sent Avery home with paperwork that said she was medically separated and a silence that said something more complicated than that. Avery climbed the remaining stairs. Up close, Voss looked like 4 years had been reasonably fair to her. Same sharp angles in the face, same quality of attention that made you feel slightly catalogued when she looked at you. She was in civilian clothes, which meant she'd come in outside the response team's official structure, which meant she was here in a capacity that wasn't on the task force manifest. "The drive," Avery said. "Solis has it." "I know Solis has it. I'm asking if you're here for the drive." Voss looked at her for a moment. "Among other things." She glanced at Avery's left arm, at the blood on her palm, with the assessing look of someone who is costing out an asset's operational status. "You need medical." "I need to check on my patients first." "Nolan, I need to check on my patients first," Avery said again, and walked past her. The third floor had been restored to something approaching functional. The response team had moved through it efficiently. The lights were back on full. The hostile she'd left restrained in the main corridor was gone. Brendan was at the nursing station with a task force agent beside him who appeared to be taking a statement. Brendan looked up when Avery came through the stairwell door, and his face did something complicated. Relief and residual fear, and something that might have been the beginning of a question he didn't know how to form. She went to Rodriguez first. He was awake, which was the first good thing she'd confirmed in the past 2 hours, and his pressure differential was within the range she'd documented before the shift ended, which meant the surgical repair was holding. He looked at her when she came in, at her scrubs, at her arm, at the general evidence of the evening, and said, "What happened to you?" "Long shift," she said, and checked his drainage and his chart and noted the entries Brendan had made, which were accurate and appropriately timed. "There was shooting," Rodriguez said. "There was." "You stayed." "I had patience." She wrote a note in his chart and capped the pen. "How's the pain?" 6 out of 10. "That's your baseline or that's elevated?" He thought about it honestly. "Baseline, maybe 5.5. "Okay." She adjusted his position slightly. The pillow under his left knee was wrong, had probably shifted when he'd tensed up during the shooting, and straightened. "Try to sleep. The surgical team will be back in the morning." He caught her wrist as she turned, the same way the witness had caught her wrist in the secured room, and she let him hold it for the same reason she'd let the other man do it. "Nurse Nolan," he said. "Yeah." "Thank you." She didn't say anything to that because the thank you felt real, and she didn't want to deflect it with something routine. She nodded and moved on. The specialist in room 6 was sleeping, vitals stable, the wound drainage within expected parameters. Okafor had released the patients from room 11 once the all-clear had come down from the response team, and Avery found her in the corridor, moving a linen cart, with the business-like efficiency of someone who had decided that the best response to an extraordinary event was to return immediately to ordinary tasks. "Your patients are fine," Okafor said before Avery asked. "Checked all of them when the lights came back." "Good call with room 11. Seemed like the logical thing." She pushed the cart a few feet and stopped. "Those men you took down, in the corridor, the elevator?" "Yes." Okafor looked at her steadily. "You want to tell me something about that?" "Not tonight," Avery said. Okafor considered this. "All right." She started pushing the cart again. "The family in waiting for bed 9. The daughter's still there. I checked on her, but she'd want to hear from you." Avery went to the waiting room. The daughter, her name was Priya. She was 26. She'd been sitting in the same chair for 6 hours by Avery's estimate. Stood up immediately when she saw her. Her eyes went to the arm first, which was starting to swell visibly, and then to Avery's face. "My father is stable. His surgery was 2 days ago, and he's healing on schedule. Tonight was—" She stopped. Tonight was a separate situation. It didn't involve the surgical patients. Priya sat back down. She put her hands over her face for a moment, the release of fear that's been held rigid for too long, and Avery sat down beside her and didn't say anything, because there was nothing to say that would be more useful than the presence. After a minute, Priya lowered her hands. "You've been here all night. I stayed late." "Are you going to be okay?" Priya asked and looked at Avery's arm again. "Probably a small fracture. I'll get it looked at." "You should do that now." I will, Avery said, which was a commitment she intended to keep within the next hour if the next hour allowed it. She went back to the corridor and found Voss waiting at the nursing station with the patience of someone who was accustomed to waiting and disliked it, but was too disciplined to show the dislike. Beside her was a man Avery didn't recognize, mid-40s, civilian clothes, but the posture of federal service, carrying a tourette and a recorder. The task force agent who'd been taking Brendan's statement had moved off down the corridor. "This is Agent Farrow," Voss said. "He's going to need the debrief." "I know." Avery looked at Farrow. "Can you give me 4 minutes?" He looked at Voss. Voss nodded almost imperceptibly. He stepped back. Avery pulled Voss a few feet down the corridor, out of easy earshot. "What's on the drive?" "That's not your... Dara." She said the name flat and direct, the way you use someone's first name when you want them to stop performing and have an actual conversation. "I found it. I'm asking what's on it." Voss looked at her for a moment. "Procurement records, falsified material requisitions through 3 defense contractors, routed through a subsidiary that Cross had partial ownership of. The witness was an accountant who'd been building the record for 18 months before they made him. How much? Current estimate is north of 40 million. Military equipment contracts, maintenance records falsified, quality certifications bought, parts that weren't rated being installed in vehicles and aircraft." She paused. "People died because of those parts." "Not in this building. In the field." Avery absorbed that. "Halden's role?" she asked. "Secondary but essential. He had access to patient records and medical documentation. When soldiers came through this facility who had been injured in incidents that might have prompted an investigation into equipment failure, Halden's documentation steered the causality away from the equipment. Injury attributed to operator error rather than material failure saved the network significant legal exposure on at least 4 separate incidents. The weight of it settled. Not abstract weight, the specific grinding weight of knowing that the patients she'd watched come through this floor, the men and women she'd cared for and argued for and stayed late for, had been documented against by the chief of surgery. That the system that was supposed to protect them had been running parallel paperwork to protect something else. "How long have you known?" Avery asked. "About Silvercrest specifically? 3 weeks. About you being here?" Voss met her eyes. "About a year." Avery didn't say anything to that. "I wasn't surveilling you," Voss said, "which was the thing you said when you had been doing something adjacent to surveilling someone and wanted to characterize it differently. I was aware of where you were. There's a distinction." "Is there?" "The text you sent tonight, when I got it, we were already 90 minutes out from Red Haven on a completely separate route. The network flagged Silvercrest as a potential contact point 4 days ago, and we were moving to verify. You accelerated the timeline." "Lucky timing." "It wasn't luck," Voss said, and there was something in her voice that was the closest she ever got to saying something personal. "It was you paying attention when everyone else had decided you weren't worth listening to, same as it always was." Avery let that sit for a second. Then she said, "I want to be in the room for Halden's debrief." "That's not standard. I have 8 years of patient documentation that shows a pattern of assessment override. Rodriguez, the specialist, at least 2 others I can identify from memory. That's material evidence, and I'm the person who can contextualize it." She looked at Voss directly. "And I want to be in the room." Voss looked at her for a long moment. "Farrow makes that call." "Then let's go talk to Farrow." Farrow made the call after 12 minutes of conversation that Avery conducted with the methodical specificity she used for patient handoffs. Relevant information in order of importance, no editorializing, no emotional argument. She laid out the documentation pattern, named the patients, gave the dates, identified the specific assessment overrides and their outcomes. When she finished, Farrow looked at his tablet and looked at her and said, "You have all of this in the chart records?" "Every word. I document everything. I have for 8 years." "Why?" She considered how to answer that honestly. "Because I knew that someday the documentation would matter more than whether anyone was listening in the moment." He nodded slowly. "You can observe. You don't participate in questioning." "Understood." They brought Halden into the conference room on the 2nd floor at 01:30 in the morning. He had a hospital attorney beside him, who had arrived with the speed of someone who'd been on call for exactly this situation, which was its own piece of information. The attorney was young and looked like he'd dressed quickly, his collar slightly off-center, and he put his hand on Halden's arm when Halden saw Avery sitting against the wall, and Halden's expression shifted. Not guilt. She kept looking for guilt in his face and not finding it. What she found instead was calculation, the perpetual, automatic calculation of a man determining the dimensions of a problem. He looked at her, and he calculated. "Dr. Halden," Farrow began, "I want to be clear about the current situation. We have the drive from the secured room. We have your co-conspirator Martin Cross in federal custody. We have a witness who survived the evening and is currently in surgery, and his prognosis is described as favorable." He set his tablet on the table. "We also have a syringe recovered from the patient's room containing potassium chloride at a concentration of approximately 40 milliequivalents per 100 milliliters, which is not a therapeutic dose for any patient presentation I'm aware of." The attorney leaned in and said something quiet to Halden. Halden listened with the patience of a man who had spent 30 years being the most important person in rooms and had not yet fully recalibrated to a room where he wasn't. "I want to be clear about something else," Farrow continued. "The falsified documentation, so 4 incidents over 32 months. Those are the counts we can currently support with what we have in hand. If there are others, and we have reason to believe there are, we will find them. The question in front of you tonight is whether you want to be the person who helps us find them or the person we find them about." Halden looked at the table. He looked at his attorney. He looked once at Avery against the wall. "You're going to use her documentation," he said. "We're going to use every piece of documented evidence available to us, yes." She flagged things that were clinically defensible. The attorney started to speak and Halden talked over him. Not angry, just the reflex of a man who had never learned to stop when he had the floor. The overrides. There were clinical grounds for each of them. "Were there clinical grounds for Rodriguez's compartment syndrome?" Avery said from the wall. The attorney turned. "She shouldn't be. Were there clinical grounds for the specialist's wound assessment?" She kept her voice level. "Because I have the timestamps of my flags and the timestamps of your overrides and the timestamps of the surgical interventions that followed, and the intervals between your assessment and the clinical deterioration are consistent across all 4 cases I've identified. That's not variation. That's a pattern." Halden looked at her for a long moment. "You've been building a file on me." "I've been documenting patient care." The file assembled itself. Something moved in his face. Not the calculation this time. Something underneath it. Something that might have been the recognition of what he'd been consistently underestimating. Not just tonight. For 8 years. "The overrides weren't about the network in every case," he said, quietly enough that the attorney immediately put a hand on his arm. "Some of them were genuine clinical disagreement." "Which ones?" Avery said. He looked at her. And then, for the first time in the 3 years she'd been on his floor, Victor Halden looked at her without the dismissal, without the performance, without the particular form of contempt that had been so constant, she'd almost stopped registering it as a choice he was making. He looked at her, and she saw a tired man in his 50s who had made a transaction at some point and had been paying the interest on it ever since. "I'll need the documentation in front of me," he said. The attorney said, "Victor, do not—" "Get me the charts," Halden said. "The ones she flagged. I want to see which ones were— I want to look at them." It took 35 minutes to pull the records. Avery sat against the wall and waited and watched Halden work through the documentation with the focus of a surgeon reading results, and the attorney sat beside him looking like a man who had accepted that the situation had left his area of authority. At 0217, Halden identified 2 cases from the 4 she'd flagged where the override had been genuinely motivated, where he had, in fact, believed his clinical judgment was superior, and where the subsequent patient course had borne out the original question without clearly vindicating either position. He was precise about it, almost scrupulously so, and Avery noted that precision because it mattered for the documentation that would follow. He identified the other 2 cases with a different quality of silence. "Those 2, Farrow said. "Walk me through those." "The specialist's wound." Halden set the chart down. "I was told to watch for his admission. I was given a heads up that he would come through." "By whom?" "Cross." through an intermediary. He looked at his hands. The instruction was to manage his clinical documentation, not to harm him, to shape the narrative of his injury in a way that was consistent with what the network needed. What did the network need? For that specific soldier, they needed his injury documented as a blast concussion with peripheral soft tissue damage. The actual wound pattern it suggested the vehicle's undercarriage had failed in a way that didn't match the reported incident. If the medical documentation reflected the actual wound pattern, it would have prompted an investigation into the vehicle. The room was quiet enough that Avery could hear the building's HVAC running. The vehicle was one of theirs, Farrow said. The maintenance contract was. Yes. Avery thought about the specialist's wound, the pattern she'd noticed, the discoloration she'd flagged, the override Halden had delivered with such practiced ease in front of the residents. She thought about the fact that the specialist had spent an extra 2 days in this hospital because of a secondary infection that had developed from the inadequately treated wound, 2 days during which his family had driven 3 hours to sit in the waiting room. And she thought about all the small, mundane human costs of a transaction that had been made in a boardroom somewhere between a surgeon and an administrator in a defense network that had decided its profit margins were worth more than honest paperwork. She was not going to say any of that in this room. She was going to stay against the wall and let Farrow do his work. But she was going to remember it. The debrief ran until 0340. By the time Farrow closed his tablet, Halden had provided enough voluntary disclosure to substantially expand the scope of the investigation beyond Silvercrest. 3 additional facilities, 2 contractors, and a name that made Farrow's assistant, who had been quietly taking notes in the corner, look up sharply for the first time in 2 hours. Halden was taken into federal custody at 0347. The attorney walked out with him, talking quietly, and Halden walked down the corridor in handcuffs with the slightly dazed bearing of a man who had just watched 30 years of professional identity reclassify itself into evidence. Avery watched him go. She didn't feel the satisfaction she'd expected to feel. She'd thought, on the nights over the past years when she'd imagined something like accountability finding its way to Halden's door, that there would be a clean feeling to it, justice as a closed circuit. What she actually felt was tired in a way that went past physical, and something that wasn't quite sadness but occupied a similar space. The waste of it, the particular waste of someone genuinely skilled who had traded that skill for something smaller than it was worth. Voss appeared beside her. You should get that arm looked at. I know. There's a team physician downstairs. In a minute. Avery looked down the corridor at the nursing station, where Brendan was still at the desk, still writing, his statement apparently running long. Brendan, she called. He looked up. Go home, she said. You've done enough. The day shift can handle the rest. I'm not done with... Leave it for the morning team. You've been here for 12 hours. Go home. He looked like he wanted to argue, and then looked like the argument had run out of fuel. He capped his pen. What about you? I'll follow shortly. He put on his jacket and gathered his bag with the slowness of a person whose body had just remembered how tired it was, and he stopped at the station door and looked at her. Nurse Nolan, he said. Yeah. I didn't know, he said, about any of it. Halden, Cross. I want you to know I didn't know. I know you didn't, Brendan. But you did. You knew something was wrong tonight. You stayed because you knew. She didn't argue with that. He nodded and left. She went to have her arm looked at. The team physician, a compact, efficient woman named Salcedo, who'd come in with the response team and had been working steadily since arrival, confirmed the radius fracture with a portable imaging unit, stabilized it in a temporary splint, and gave her the particular look of a medical professional treating another medical professional and choosing not to comment on how long the injury had been unaddressed. You're going to need a proper cast tomorrow, Salcedo said. I know. And you should sleep. I'm aware of the general recommendation, yes. Salcedo smiled despite herself. 48 hours minimum before you consider returning to floor work. The fracture is minor, but you need the stabilization period. Avery was in the corridor outside the treatment room, arm splinted, looking at her phone, when Farrow found her at 0420. The witness came through surgery, he said. He's in recovery. Prognosis is good. Good. He asked about you. Farrow checked his notes. He said, and this is a direct quote from the recovery room nurse, "The woman with the dark hair who fixed my breathing. I need to know if she's okay." Avery looked at the floor for a moment. "Tell him I'm okay." "I will." Farrow put his tablet under his arm. "The drive is authenticated. The data is intact. Based on what Halden disclosed tonight, we're looking at a federal case that's going to take 18 months to fully prosecute, but the primary charges are solid." He looked at her with the same expression Solis had used, the recalibration expression. "We're going to need formal statements from you about the documentation pattern, the patient records, all of it. I'll provide everything I have. It's going to be public, the case, the records. It'll come out that the documentation evidence originated with a floor nurse." "That's fine," she said. He nodded. Then, "Agent Voss indicated you have a background that's relevant to this evening's events. Agent Voss can characterize my background however she sees fit." He took the hint. "Thank you, Nurse Nolan. Genuinely." He walked away and she stood in the corridor and looked at the ceiling for a moment. The fluorescent lights running normally now, no emergency red, just the ordinary institutional light of a building that had gone through something and come out the other side. She found Voss in the stairwell at 0435, which was where Voss went when she wanted to have a conversation that wasn't in a room with recording equipment. Old habit from a previous context, and Avery recognized it and went there. "The name Halden gave Farrow," Avery said. "The one that made the note-taker look up." Voss leaned against the railing. "General Purcell, Defense Procurement Oversight, Fort Arden. He's the connection between the contractors and the military approval chain. He's the top of it, which means the case goes significantly higher than a hospital administrator and a surgeon. And the network will know by morning that Cross and Halden are in custody. They already know." Voss looked at her. "Which means Purcell knows. And Purcell has resources that Cross and Halden didn't have." Avery processed this. "The witness is in a federal medical facility as of an hour ago. He's protected. The drive is authenticated and in custody." "Yes." "So what's the exposure?" Voss was quiet for a moment, which was not the same as not answering. "The case against Purcell runs through the documentation chain. The falsified records, the pattern Halden confirmed tonight. It's solid evidence, but it's the kind of evidence that requires a compliant witness to contextualize for a jury. The witness is cooperative. The problem is that Purcell's team is going to move to discredit the medical documentation before the case reaches indictment." "How?" "By arguing the documentation pattern reflects nursing error rather than deliberate manipulation." Voss looked at her steadily. "They're going to argue that your flags were incorrect, that Halden's overrides were appropriate clinical judgment, and that the outcomes you've attributed to neglect were within standard variance." Avery understood what Voss was telling her. "They're going to put 8 years of my assessments on trial. They're going to try." "Let them," Avery said. Voss tilted her head slightly. "A question." "I have 8 years of documentation," Avery said. "Every flag, every timestamp, every outcome. I have the comparison between what I documented and what the chart shows, and what actually happened to every one of those patients." She looked at Voss with something that wasn't anger and wasn't satisfaction, but was a steady, settled thing that had been building for 8 years without a name. "If they want to put my clinical judgment in front of a jury, they are going to regret that decision." Voss looked at her for a long moment. Something moved in her expression that was as close as Dara Voss ever got to showing something real. "There's something else," she said. "There usually is." "We found a second drive." She reached into her jacket pocket and held it up. Not the matte black drive from the Sharps container, a different one, lighter colored. "This was in the portfolio Cross was carrying in the basement when you found him." "I know about the portfolio." "This drive isn't procurement records." Voss held it between her fingers. "It's personnel files. Specifically, files on individuals within this hospital who were identified as potential liabilities to the network. People who might notice things and report them." Avery was quiet. "Your name is on it," Voss said. "Has been for about 14 months. They'd been watching your documentation pattern. Cross flagged you to the network after you escalated the Rodriguez complaint through formal channels. She looked at the drive. There are notations about your background. Partial. They didn't have the full picture, but they had enough to know you were more than a floor nurse. They were going to do something about that. The notation reads, pending resolution. Voss put the drive back in her pocket. Tonight was resolution. The stairwell was very quiet. They didn't send those men for the witness, Avery said. The witness was primary, you were secondary. Voss met her eyes. If the witness was neutralized and the drive was retrieved, the secondary objective was to ensure the person who'd been building a parallel documentation case against Halden didn't walk out of the building. 8 years. 8 years of invisible work, of flagging things that got overridden, of staying late and checking on patients and filing the kind of careful, meticulous, undramatic documentation that nobody reads until suddenly it's the most important thing in the room. 8 years of being the nurse nobody noticed. They'd noticed. Avery stood in the stairwell and breathed. There's one more thing, Voss said, and her voice had shifted into the register she used when she was delivering something she'd been holding back. Purcell moved this morning before we could get a hold order in place. Moved how? He resigned his commission at 0400, filed a medical separation, which triggers a 60-day review period before federal charges can be formally filed. His legal team got ahead of the indictment by 4 hours. Voss looked at her. He's not in custody. He's in his home in Arlington under voluntary self-confinement, which is meaningless, and his attorneys have already filed a motion to suppress the drive evidence on chain of custody grounds. Avery looked at her. On what basis? They're arguing the drive was recovered by an unauthorized civilian in a compromised security environment and the chain of custody is invalid. Voss paused. They're naming you specifically as the unauthorized civilian. The chain of custody argument. The drive she had peeled off the Sharps container with her bare hands, in a darkened room, without gloves, in the middle of a building under active attack, and handed to a federal agent who had put it directly into a secure evidence container. That's the argument, Avery said. That's the argument they're leading with. She looked at the stairwell wall. She looked at her splinted arm. She thought about the Sharps container, the specific adhesive tape, the way the drive had been positioned, the precise sequence of what she'd touched and when, and in what order, and she ran through it with the same methodical attention she applied to everything she documented. Get me in front of the evidence team, she said. Avery, get me in front of the evidence team in the next 2 hours before their motion gets traction. She pushed off the railing. I can walk through every step of the recovery sequence, every contact point, every decision, every reason the chain of custody holds. She started up the stairs. And I want the Sharps container from that room preserved and logged before anyone touches it further. It's already logged. Good. She was moving. Where's the evidence team? Second floor conference room. She took the stairs at pace and came out on the second floor and walked the corridor with the particular velocity of someone who had decided on a direction, her splinted arm held close, her right hand steady. The evidence team had 4 people and a table full of equipment, and they looked up when she came through the door in her scrubs with a federal agent behind her, and she said, before anyone could speak, "My name is Avery Nolan. I'm the person who recovered the primary drive from the secured patient room. I want to walk you through every point of contact in the recovery sequence, and I want to start with the container it was mounted on." The lead evidence technician, a careful-looking man named Briggs, who wore his gloves like a reflex, looked at Voss. Voss nodded. Briggs looked back at Avery. "All right," he said, "from the beginning." She sat down, and from somewhere down the corridor, muffled by 2 sets of doors and the institutional ambience of a building that had been through a night and was grinding toward morning, she heard a phone ring and Pharaoh's voice answering it, and the specific quality of the silence that followed the answer, the silence of a person receiving news that changes the shape of the next conversation. He appeared in the doorway of the conference room 30 seconds later. He looked at Voss, then at Avery. Purcell's attorneys just filed a second motion, he said. They've produced a document, a personnel evaluation from 14 months ago, signed by Martin Cross. He held his tablet so they could see the screen. It's a formal internal review of your nursing performance. It documents, and I'm reading directly, a pattern of clinical overreach, insubordination, and documented conflicts with supervising physicians. It recommends termination, which was apparently not acted upon. He lowered the tablet. They're going to use it to argue that your documentation pattern was retaliatory, that you were building a case against Halden because of a disciplinary conflict, not because of genuine clinical concerns. Avery looked at the tablet. She had never seen that document before. She had never been subject to a formal performance review at Silvercrest. Not one had ever been filed, not one had ever been discussed with her, not one existed in her personnel file as of this morning. That document, she said, was created after I flagged the Rodriguez case through formal channels 14 months ago. Can you prove that? The metadata on that file will show when it was created and when it was last modified, she said. And I have 14 months of shift schedules, patient outcomes, and incident reports that will show what my actual performance record looks like. She looked at Farrow steadily. But what I want to know is how Purcell's attorneys had that document at 04:45 in the morning, 4 hours after Cross was taken into federal custody. Farrow was quiet. Cross made a call, Voss said. She wasn't looking at Farrow. She was looking at the wall with the expression of someone adding figures that weren't coming out right. Before we got to him in the basement, the radio contact we intercepted, he wasn't just coordinating the hostile team. He was passing something to Purcell's people. The document was pre-staged, Avery said. Yes, which means they anticipated that their operation would fail tonight. They had a legal contingency already in place. She looked at the table. They weren't just planning to take the witness and the drive. They were planning for the scenario where that failed and the case moved into legal proceedings. And in that scenario, the strategy was to destroy the evidentiary value of 8 years of my documentation by painting me as a disgruntled nurse with a grudge. The room was very quiet. That's a sophisticated contingency, Briggs said from the far end of the table, and everyone looked at him, and he looked mildly embarrassed to have spoken, but he wasn't wrong. It means Purcell has been involved in the legal strategy from the beginning, Voss said. Not just the procurement side. He understood from the start that if this ever surfaced, the documentation trail was the vulnerability and the documentation trail ran through Nolan. Avery looked at her splinted arm. She looked at her hands. She looked at the evidence on the table. The matte black drive in its sealed container, the photography logs, the chain of custody sheets. She had been dismissed. She had been overridden and talked over and walked past and told she was just a nurse who thought she knew more than doctors. And she had documented everything because she'd understood, in some cellular way, that the day would come when documentation was the only weapon that mattered. That day was now. And Purcell had spent 14 months quietly building a document that would arrive at exactly this moment and try to take it from her. Get me the metadata analysis on that performance review, she said. And get me the original timestamp on my first formal escalation of the Rodriguez case, which is in the hospital's incident reporting system. She looked at Farrow. If that document was created after my escalation, and the metadata will show that, then the sequence tells its own story. Farrow nodded and stepped out of the room with his phone. Voss stayed. She stood at the edge of the table and looked at Avery with an expression that was as close to open as Dara Voss ever allowed herself in a professional context. You knew this was coming, Avery said. Not tonight specifically, but something like this. I thought you deserved to know the full scope of it before it hit you. That's why you're here, not just the drive. No, Voss said, not just the drive. Avery was quiet for a moment. What aren't you telling me? Voss reached into her jacket again. Not the drive this time, a folded document, paper, which was unusual enough in this environment to be notable. She set it on the table in front of Avery. Avery picked it up and unfolded it. It was dated 6 weeks ago. It bore the letterhead of a federal oversight body she recognized. She would have recognized it anywhere. It was connected to the context she'd sealed away. And it was addressed to her by name at Silvercrest Military Medical Center, and it had been intercepted and withheld before it reached her. She read it twice. Then she set it down on the table carefully, the way you set something down when your hands are not entirely steady. They intercepted my mail, she said. Cross had access to administrative sorting. The letter was flagged and held. Voss looked at her. It arrived 6 weeks ago. You were never supposed to see it. Avery looked at the letter on the table. The letter that would have changed everything. The letter was from the Army Medical Specialist Corps Review Board, and it was an offer of reinstatement. Not a general inquiry, not a preliminary feeler. A formal, specific offer with a posting attached. Senior medical advisor to a joint military federal task force operating out of a facility in Virginia. A role that sat at the intersection of field medicine and institutional oversight. The exact intersection where her two lives had always collided without resolution. The offer cited her service record, her separation circumstances, and, in language that was carefully bureaucratic but unmistakably pointed, noted that the circumstances of her separation had been reviewed and found to reflect situational factors rather than performance deficiencies. 8 words that had taken 8 years to arrive. She read it a third time. The offer had an expiration date, 30 days from the letter's date. The letter was 6 weeks old. "It's expired," she said. "The board extended it," Voss said. "When the letter didn't generate a response, they flagged it for follow-up. I made a call 3 days ago, before we moved on Silvercrest, and the extension was granted." She paused. "It's valid for another 30 days from yesterday." Avery set the letter down again. She looked at it on the table, the formal letterhead, the specific language, the signature of someone she'd never met who had reviewed a file she'd never seen and arrived at a conclusion she'd stopped expecting. She didn't feel what she thought she'd feel. She'd imagined, in the abstract, what it would be like to have that door open again, and she'd imagined it as clean and clarifying. What it actually felt like was complicated in a way she hadn't budgeted for, because the 8 years she'd spent on the other side of that closed door had not been the wrong years. They had been her years. The patients were real. The work was real. Rodriguez's leg was real, and the specialist's wound was real, and the family in the waiting room, and Okafor, and Brendan, and the hawk on the parking structure light pole, and the vending machine that gave you 2 bags of pretzels. All of it was real, and none of it canceled any of the rest of it. "I need to think about it," she said. Voss nodded like she'd expected exactly that answer. Farrow came back into the room at 05:12 with his phone in hand and the expression of someone who'd just received information that had restructured his morning. "Metadata analysis on the performance review document," he said. "File creation date is 14 months ago, 2 days after Nolan's formal escalation of the Rodriguez incident. Last modified date is 11 months ago." He looked at Avery. "The document was created in response to your escalation and then modified again approximately 3 months later. Crosses digital signatures on both versions." "So it was created as a weapon," Briggs said from the far end of the table. And this time nobody looked at him with surprise because the observation was accurate and obvious. "Purcell's attorneys filed on a document that has creation metadata contradicting its stated purpose," Farrow continued. "That's a problem for them. But the more immediate problem is that the motion to suppress the drive evidence is going to a federal judge at 0900 this morning, and we need to be prepared to counter it." He looked at Avery. "Your deposition of the chain of custody recovery is going to be central to that counter." "Then let's get it on record," she said. They spent the next 2 hours doing exactly that. Briggs led the documentation process with the precise, unhurried thoroughness of someone who understood that this record was going to be read by a federal judge and potentially by a jury, and Avery walked through every second of what she'd done in that secured room. The approach to the Sharps container, the visual identification of the drive before contact, the decision to use the adhesive edge rather than the drive surface, the transfer to Solis's immediate placement in the evidence container, the unbroken sequence from discovery to secured custody. She was not a perfect witness. She said approximately, where she wasn't certain of exact timing. She acknowledged that her left arm had been compromised and that her grip on the container edge might have been less controlled than she'd intended. She said all of this plainly and without qualification because a witness who claims perfect recall in chaotic conditions is not a credible witness, and she understood that the value of her testimony was its specificity, not its tidiness. Briggs looked at her at the end of the session and said, with the quiet satisfaction of a craftsman reviewing finished work, "That'll hold." At 07:14, the day shift arrived at Silvercrest and found a hospital that looked like itself on the surface and was not itself underneath. The overnight incident had moved through the staff communication chain with the speed that significant events always move through hospital staff. which was faster than administration preferred and slower than the truth actually warranted. There were federal personnel still in the building. There were rooms that were taped off. There was a nursing station on the third floor with a statement log sitting on the counter that told its own story to anyone who thought about what kind of events generated statement logs. Avery was in the break room when the day shift supervisor, a practical woman named Haverford, who ran the nursing schedule with the efficiency of someone who had decided that the administrative side of the job was itself a form of patient care, found her. Haverford looked at the splint, at the scrubs that had been on Avery's body for 14 hours, at the coffee cup that was her third of the morning. "Go home," Haverford said. "I was going to brief the day team on—" "Okafor briefed them. Go home, Nolan." Avery looked at her. Haverford was not a woman who wasted words or made room for argument she wasn't going to hear. "All right," Avery said. She went to her locker and changed out of the scrubs and put on the clothes she'd had in her bag, jeans, a gray sweater, boots, and stood at her locker for a moment with her hand on the door. The locker had been hers for 8 years. It had a dent at the bottom left corner where a supply cart had hit it during a rush in year 2, and a small strip of medical tape on the inside of the door that she'd used 3 years ago to hold a note she'd written herself and then removed after she'd memorized it. The note had been a list of patient names, people she'd worried about, people whose cases had kept her awake, and she'd stopped keeping the list when she'd realized she remembered all of them without it. She closed the locker and went out. The morning was cold and clear, the Colorado sky doing what it did in late autumn, a blue that had no ambiguity in it, sharp and direct. The parking lot had 2 federal vehicles still positioned near the emergency bay and a uniformed officer at the entrance who checked her badge without ceremony and waved her through. She sat in her car for a few minutes without starting it. She thought about the letter on the evidence table upstairs. She thought about the sealed box she'd been carrying for 8 years, and what it meant that it was no longer sealed. Not because she'd opened it, but because the night had opened it for her, in front of people who now knew what was inside. Her phone rang. Unknown number, but the area code was Virginia. She answered it. "Nurse Nolan," a man's voice, measured and direct. "My name is Colonel Armand Reyes. I'm the convening authority for the review board that issued the letter you received last night." She waited. "I understand you've had a significant evening," he said. "That's one characterization. I've been briefed on the Silvercrest situation. Partially. I won't pretend I have the full picture yet." A pause. "I'm calling because I want you to know that the offer in that letter is genuine, and the extension is genuine, and I'd like the opportunity to speak with you directly before you make any decision about it. Not today. When you've slept and had your arm properly treated and have had time to think." "How do you know about my arm?" "Agent Voss filed a preliminary incident report at 0600. She's thorough." "She is," Avery said. "I'm not going to pressure you. The role is real and the need is real, and we believe you're the right person for it, but the board made a decision 8 years ago that I think we got wrong, and I'm not going to compound that error by pushing you toward a choice you haven't had time to consider properly." Another pause. "That's all I wanted to say." She looked through the windshield at the hospital building, the brick facade, the emergency bay, the windows of the third floor where she could see the shape of the nursing station through the glass. "Colonel Reyes," she said. "Yes." "The soldiers who were harmed by the falsified equipment documentation, the ones whose injuries were misattributed, I want to know that their records will be corrected, specifically and individually. Not a general statement about the investigation. Each record." A brief silence. "That's a commitment I can make on behalf of the board." "Then I'll call you next week," she said, and ended the call. She started the car and drove home. The federal case against General Purcell moved faster than federal cases typically moved, which was a reflection of the quality of the evidence rather than any urgency on the part of the system. Urgency was not something the federal legal apparatus did by nature. It did thoroughness, which was slower and more durable. The chain of custody challenge was heard on a Thursday morning, 6 days after the night at Silvercrest. Avery sat in a federal courtroom anteroom and waited while Farrow's team presented the metadata analysis, the deposition record, and Briggs's technical assessment of the drive recovery sequence. The challenge was denied in full by a judge who wrote, in her ruling, that the chain of custody had been established with sufficient specificity and that the motion appeared designed to obscure rather than address legitimate evidentiary concerns. Language that Farrow later described to Avery as judicial understatement for this argument was bad, and the people making it knew it. The suppression motion failing was the first domino. The second was the witness. His name, released after the protective hold was lifted, was Thomas Ardell. He was 43 years old, had been a contract accountant for the defense subsidiary for 11 years, and had spent the last 18 months of that employment systematically documenting every falsified requisition, every fraudulent certification, and every payment that had moved through the network. He had built the record the way Avery had built hers, quietly, methodically, without anyone noticing that the person they'd overlooked was the person most capable of dismantling what they'd built. He gave his first on-record statement from a federal medical facility in a bed that still had monitoring equipment attached, because his recovery from the chest surgery was progressing but was not complete, and he gave it in a clear, even voice that Avery heard about secondhand from Farrow. He named names. He provided account numbers. He cited specific contract numbers against specific maintenance records, against specific incident reports from specific vehicles. He had cross-referenced everything. He had, in other words, done exactly what you do when you understand that your testimony will be attacked, and your only defense is documentation so complete that attacking it requires attacking arithmetic. Avery recognized the strategy. She'd been running it herself for 8 years. The formal indictments came down on a Wednesday, 4 weeks after Silvercrest. General Purcell was charged on 11 counts: procurement fraud, obstruction of justice, conspiracy to commit murder in the first degree for the witness assassination attempt, and 4 counts related to the deaths of soldiers and field incidents linked to the falsified equipment. His resignation and the voluntary confinement had not, in the end, bought him anything except the 4 hours he'd had to call his attorneys, which had been enough to file the suppression motion and not enough to survive it. He turned himself in at a federal courthouse in Arlington on a gray November morning, and the photograph showed a man who had walked into rooms wearing command authority for 30 years, walking into a room where it meant nothing. The photographs were on the front pages of 2 newspapers and the home pages of 6 news outlets, and Avery saw them on her phone while sitting in an orthopedist's office waiting for her follow-up on the radius fracture, which had healed cleanly and ahead of schedule because she had followed the treatment protocol exactly, which was what she did with protocols that she agreed with. Martin Cross pleaded guilty to federal conspiracy charges 10 days after indictment, which was fast enough to suggest that his attorneys had told him in clear terms what a trial would look like, and he had agreed with their assessment. He received a sentence of 12 years and the permanent revocation of his administrative certifications, which meant he would not hold a hospital administrative position again in his lifetime. The plea agreement required his full cooperation with the Purcell prosecution, which he provided, and the cooperation was the reason his sentence was 12 years rather than the 17 the prosecutor's office had initially sought. Victor Halden's case moved on a separate track. His cooperation on the night of the incident and in the days following had substantively reduced his criminal exposure, and his attorneys negotiated a plea that resulted in 3 years of federal supervision, substantial financial penalties, and the permanent revocation of his medical license by the state of Colorado. The revocation was processed by the medical board 6 weeks after the indictment, and the board's public statement cited falsification of clinical documentation and a failure of the fiduciary duty owed to patients under his care, language that was accurate and that Avery read twice before she put down her phone. She did not feel triumphant about Halden. She'd expected to, and she didn't, and she spent some time sitting with that discrepancy. What she felt was closer to the particular exhaustion of a long argument that has finally ended. Not victory, just the cessation of a sustained expenditure of energy. The waste of it still sat with her, the skill and the contempt living in the same person, the way they'd apparently coexisted for 30 years without one diminishing the other, the way the skill had been real and the harm had been real simultaneously. She didn't know what to do with that complexity, and she didn't try to resolve it. Some things didn't resolve. You just carried them in a form you could manage. The soldiers whose records had been falsified were identified, and their documentation was corrected through a formal administrative process that Avery was asked to consult on, which she did. spending 2 Saturdays in a federal building in Denver reviewing records with a team of military medical reviewers and providing the clinical analysis that established what the actual injury patterns had indicated versus what the charts had said. 4 of the soldiers were still alive and were notified that their records had been amended. 2 were not, and the corrections were made to their posthumous files, and their families were notified. And that was a harder kind of work, the work of accounting to people for something that couldn't be undone, only acknowledged. One of the living soldiers, a sergeant named Willis, who'd been stationed at Fort Arden and whose knee injury had been documented as operator error rather than vehicle failure, called the administrative office and asked who had identified the discrepancy in his record. The administrator told him it originated with clinical documentation from a nurse at Silvercrest Military Medical Center. Willis said, "I want to call her." The call came on a Tuesday afternoon when Avery was in the orthopedist's waiting room for the second time, which was less dramatic than the first. His voice was careful in the way of someone who had prepared what they wanted to say and was aware that prepared things sometimes failed in delivery. "I've been walking wrong for 2 years," he said. I've been walking, but wrong, compensating, because the physical therapy was designed around the wrong diagnosis." A pause. "They're going to redo the PT now that the record's right. The doc says I might get another 15% range of motion back if I do the work." "That's good," Avery said. It's because of you." "It's because you had a nurse 8 years ago who documented your admission correctly," she said. "The record was always there. It just needed someone to look at it honestly." "You're being modest." "I'm being accurate. There's a difference." He was quiet for a moment. "Can I ask you something?" "Sure." "Why did you stay?" "That night, you were off shift. You could have left and none of this. You would have been home." She thought about how to answer that honestly, the way she tried to answer everything. "I stayed because something didn't look right, and I couldn't leave something that didn't look right without knowing what it was." She looked at the waiting room wall, the generic art, the plant in the corner that was doing its best. That's the whole answer. It's not more complicated than that. "That's enough," Willis said. "Yeah," she said. "I think it is." The formal commendation from Silvercrest's new administration came in the form of a ceremony that Avery had tried twice to get out of and failed both times, because Haverford had blocked both escape routes with the calm efficiency she applied to the nursing schedule. The new interim director, a woman named Castillo, who'd been brought in from a regional health authority while a permanent replacement was sought, stood in the third-floor conference room on a Friday afternoon in December with approximately 40 people who worked the hospital and presented Avery with a formal commendation for actions taken during the incident that had resulted in the protection of patients, the preservation of federal evidence, and the prevention of additional casualties. The language was formal and complete, and Avery stood and received it with the slight awkwardness of a person who is accustomed to being invisible and has not yet fully adjusted to the alternative. She shook Castillo's hand. She shook hands with people she'd worked beside for years, who looked at her with an expression that was a mixture of things: respect and something that might have been the faint discomfort of recognition, of understanding that they had looked at this person every day and not fully seen her. Okafor hugged her, which was not standard protocol, and which Avery was fine with. Brendan stood at the back of the room, and when she caught his eye, he gave her a nod that was the particular nod of someone who had decided that words were insufficient and was going to let the nod do the work. She nodded back. Patel, the resident who had been on Halden's rounds and had done the thing of dropping her eyes to the floor, was there too, which Avery hadn't expected. Patel waited until most of the room had filtered out before she came over, and she had the expression of someone who had rehearsed something and was now finding the rehearsed version inadequate. "I should have said something," Patel said. "When he talked about you like that in the corridor, I heard him. I didn't say anything." "You were a first-year resident. That's not an excuse." "No," Avery agreed. "It's not. But it's a reason." She looked at her. "You'll have other corridors." Patel nodded. Something settled in her face. Not absolution, which wasn't Avery's to give, and which Patel probably understood wasn't what she'd come for. Just acknowledgement. the recognition that the account had been noted and was now part of what she carried forward. "You're leaving," Patel said. It wasn't a question. At the end of the month. The new posting. People are talking. People always talk. Patel almost smiled. "Will you come back?" Avery thought about it. The honest answer was that she didn't know, and the honest answer was also that Silvercrest had become something different from what it had been, not just because of the night in November, but because of what the night had made visible, what it had forced into the light and required people to look at. The culture of the floor was already shifting, not dramatically, not overnight, because institutions don't shift dramatically or overnight, but there were small signs that Avery noticed because she noticed things. Nursing assessments being followed up on without requiring escalation. A resident who had stopped, twice, to ask the floor nurse's opinion before finalizing a decision. Haverford had quietly implemented a new documentation review protocol that required attending physician sign-off on any nursing flag that was being overridden, which was not a large structural change, but was the kind of specific targeted adjustment that had real teeth. Small things. The kind of things that didn't make the news and didn't generate ceremonies. The kind of things that saved lives in the aggregate, over years, in the accumulated weight of what didn't go wrong. "Maybe," she said, which was more honest than yes or no. She cleaned out her locker on a Thursday morning, last day of the month. She didn't have much, a few personal items, a spare pair of shoes, the CE module she'd been working through that she'd print and finish on the plane. She stood at the locker and looked at the dent at the bottom left corner and the adhesive ghost on the inside of the door, where the strip of tape had been, and she felt something that she was going to call completion, rather than sadness, because completion was more accurate. She had not been wrong to come here. She had not been wrong to become a nurse. The 8 years were not a detour or a recovery period or a consolation prize. They were what she had chosen to do with her hands and her attention and her particular capacity for seeing things that other people's eyes slid past. And the value of that work was not diminished by the fact that it had gone largely unnoticed while she was doing it. The invisibility was the thing she'd been thinking about on and off since the night in November. Not with anger anymore. The anger had burned down to something quieter and more useful. She'd been thinking about what it meant that the people who'd decided she was ignorable had built their entire strategy around the assumption that she'd stay that way, that the documentation would stay invisible because the person keeping it was invisible, that the network was safe because the only person tracking the pattern was someone everyone had agreed didn't matter. They had been wrong about so many things, but the thing they'd been most catastrophically wrong about was that one. Because the invisible people are the ones who see everything. The ones who get dismissed are the ones who learn to document every dismissal because they understand, in the bones of their professional experience, that the day will come when the documentation is all that stands between the truth and its erasure. The ones who get told they don't know what they're talking about are the ones who learn to know it better, to know it precisely, to know it in a way that can survive a federal evidentiary hearing and a chain of custody challenge, and a fraudulent performance review filed by a man who understood that her 8 years of careful work was the most dangerous thing to his operation. She had not saved those patients because she was extraordinary. She had saved them because she had paid attention when the system around her had stopped doing so, and she had written it all down, and she had not quit. That was the whole story. It was not a complicated story. Thomas Ardell, the witness, Thomas now that she knew his name, had sent her a letter, paper handwritten, which felt deliberate in the way of someone who'd decided that the medium was part of the message. He was in outpatient recovery, the chest wound healing slowly but correctly, the physical therapy progressing. He was cooperating with the Purcell prosecution and expected to testify in the spring. He wrote that he'd spent 11 years as an accountant watching numbers that didn't add up, and had understood somewhere around year 8 that the numbers were going to keep not adding up until someone made them stop. "I think we were doing the same job," he'd written, "in different rooms, with different tools. I think we were both counting things that other people had decided not to count." She'd read that line several times. She'd written back, a short letter, also paper, because the medium felt right. She told him she thought he was correct. She told him the PT was worth the work, that the early sessions were the hardest and the gains came later and then arrived all at once in a way that felt disproportionate to the effort and wasn't. She told him his testimony mattered, not because she thought he needed to be told, but because sometimes things that are true are still worth saying out loud. She sealed the letter and mailed it on her way out of Red Haven. Bookdown. The drive to Denver took 2 hours, and she made it in the kind of early morning darkness that preceded a clear day. The mountains to the west still shadows against a sky that was just beginning to consider light. She thought about Voss in the stairwell. She thought about Reyes on the phone. She thought about the role in Virginia and what it meant and what it didn't mean. It didn't mean she was finished being a nurse. That was the thing she'd needed to be sure of before she'd called Reyes back, and she was sure of it now. The core posting came with a medical advisory component that was substantive, not ornamental. She'd read the role description 4 times and asked specific questions about the clinical scope and gotten specific answers. The work of keeping people alive, of paying attention to the things that other people's frameworks caused them to miss, was not going to stop being her work because the address changed and the uniform returned. What was changing was the scale, the room she'd be in, the table she'd finally have a formal seat at rather than a chair pushed against the wall. She thought about what it would have meant to have had that seat 8 years ago, and she thought about whether she'd have been the same person sitting in it, and she decided that the answer was no. The 8 years had made her into the person who could use the seat. The invisibility had taught her what visibility actually required. You couldn't learn that in a conference room. You learned it in a corridor at 0600 with a medication cart and a patient who needed someone to notice the thing that everyone else had decided wasn't there. The airport was quiet at this hour. She moved through it efficiently, the way she moved through spaces she needed to cover. Not rushing, not wasting motion, knowing where she was going. Her bag was light. She'd always packed light. It was the habit of someone who'd learned that the things you needed most couldn't be packed. She found her gate and sat and looked out at the tarmac, where the morning was now genuinely arriving. The sky going from suggestion to declaration, the light running across the concrete in long horizontal lines that turned ordinary surfaces into something that looked briefly considered. Her phone had a message from Okafor. No text, just a photograph. The nursing station on the 3rd floor, the morning shift beginning, coffee cups and charts and the ordinary machinery of a floor that was doing what floors did. Okafor had her back to the camera, but she'd arranged the shot so the notation board was visible, and there was a new addition to the board, written in the green marker that was used for institutional notices. Nursing assessments are clinical documentation. Treat them accordingly. It was signed with Haverford's initials, which meant it was now policy. Avery looked at that for a while. Then she put her phone in her pocket and looked at the runway and waited for her flight, which arrived on time, which was not always how things arrived, but was how this one did. And she boarded without ceremony and found her seat and settled in with the particular quality of stillness she'd learned in the years before nursing and carried into them. The stillness of someone who has done what needed doing and is now simply present in the moment after. The plane climbed. Below her, Red Haven contracted to geometry. Streets and buildings, and the small, precise square of Silvercrest Military Medical Center with its parking structure and its emergency bay and its 3rd-floor windows that were lit from the inside because the day shift was running and the patients were being cared for and the documentation was being written correctly. She looked at it until the clouds closed beneath her and it was gone. She'd been the nurse nobody noticed for 8 years. She'd flagged infections and stayed late and written everything down and been talked over in corridors by men who'd decided she was furniture. She'd done all of this without recognition and without the expectation of it because the patients were real and the work was real and those 2 facts were sufficient reason to do it, every day, to the standard the job required. And then, in a single night, everything she had quietly built had been the difference between lives lost and lives saved. Not because she was exceptional, not because she had a hidden identity or a secret past or some particular grace that other people lacked, but because she had paid attention and she had written it down and she had not let anyone talk her out of what she knew. The plane leveled out above the clouds. The attendant came through with water, and she took it and drank it and looked at the white, undifferentiated field below her that could have been anything, that was just cloud the way it always was, and she thought about the soldiers she'd sat with over 8 years. The ones who'd arrived broken and left walking, the ones who'd been afraid and needed someone to stay in the room, the ones who'd grabbed her wrist in the dark because they needed 1 second of contact before the pain got worse. She would carry them. She already had been carrying them. They went with her the way the skills went and the way the stillness went. Not as weight, exactly, but as foundation. As the specific and irreplaceable knowledge of what the work actually cost and what it was actually worth. She thought about what she'd tell someone, if someone asked, a young nurse maybe, or a young soldier, or anyone who'd been told often enough that they didn't matter that they'd started to consider whether it might be true. She would tell them this. The people who need you to be invisible are the people who are afraid of what you see. She would tell them, document everything. She would tell them, the work you do when no one is watching is the work that matters most, because it is the only work that is entirely yours. The clouds broke briefly, and below her was mountain, white and enormous, and entirely indifferent to the small specific human life looking down at it. And then the clouds closed again, and she settled back and looked at the seat in front of her and was simply a person on a plane, going somewhere, carrying everything she had built, ready for whatever room came next.